Welcome all. Welcome to this AimExcellence NRB question answer discussion. And this is pretty interesting question because to answer it correctly, you have to have a pretty clear understanding of not only the orthopedic pathology that have been given in this particular question, but also the radiological characteristic, radiological finding, and also the pathology that is actually giving a resultant effect in the serum marker of calcium phosphate and alkaline phosphatase. So after the game, Warner came to you, slightly depressed, complained the localized tenderness in bone, also complained of hearing loss. So on palpation, slight increased temperature, you did CT scan, got this particular image. On inquiry, he also told he changed his cap sizes in the past. Serum level will show. So you have 4 sets of calcium, phosphorus and alkaline phosphatase level. To answer it correctly, you can go by 2 ways. To pinpoint the pathology by seeing the important information that been laid in this particular question itself. That is, number 1 is localized tenderness in the bone, and also complaint of hearing loss. On palpation, you will see on touching the bone the slight increased temperature. Also there will be little tenderness. You did CT scan, got this particular image. This is a very important image. And also he told you that in the past he changed his cap sizes. So this particular CT scan view is known as scout view. Scout view, it's a preliminary view before doing the contrast enhanced CT scan, scout view, but it actually gives a pretty clear idea about the pathology. And here it is seen this cranium the size is getting increased, and it seems the frontal bone and the skull is falling over the face, and it is actually mimicking this kind of style of hat. It is a very predominant kind of cap, and that is known as Tam O Shanter sign. Tam O Shanter sign. It is actually created from Robert Burns poem of same name. Okay, and this particular finding, this Tam O Shanter sign, coupled with widening of the diploid spaces, it is seen in cases of Paget disease. Paget disease. But even then, to answer this particular question correctly, you have to have a pretty clear understanding not only what are the changes in the serum marker that is seen in a cases of Paget disease, but their values. So normal value of calcium is 8.5 to 10.2 milligram per deciliter. 10.2 milligram per deciliter. For the phosphorus, phosphate is actually delineated by the serum phosphorus level, that is 2.5 to 4.5, and that varies with the age of the patient also. Here the age is not mentioned in this question, but it is never goes beyond generally 4.5 to 5. And also the alkaline phosphatase, the normal value is 44 to 147 international unit per liter. So we know in Paget disease, this particular finding is seen in Paget disease. Also GG syndrome, Gorlin syndrome, where there is widening of the skull with platypsia, which actually giving the appearance the skull is falling over the face, like this particular Tam O Shanter had. And in the platypsia, the angle between the occiput and the cervical vertebra is increased. Occiput and the cervical vertebra is increased. Which is giving the appearance it is falling over on the face, like this particular head style. But here what you are saying, in Paget disease, we know the normal parameters. So this particular finding, where calcium is within 8.5 to 10.2, phosphorus is within 2.5 to 4.5, and alkaline phosphatase is the only parameter that is raised, which is actually mimicking the Paget disease, is the answer. Let's talk about the other findings. Here all the parameters are normal. It is seen in cases of osteoporosis. Now here calcium is increased, phosphorus is decreased, alkaline phosphatase is increased. That is seen in cases of primary hyperparathyroidism, which is generally due to the tumor in the parathyroid. Tumor that is happening in the parathyroid. And here it is the cases of secondary hyperparathyroidism, because calcium is decreased, phosphorus is increased, and alkaline phosphatase is increased. That is mainly seen in cases of chronic kidney disease. And the difference between this and the tertiary hyperparathyroidism is the only thing, their calcium is also going to be increased. We have to remember, in the tertiary hyperparathyroidism, calcium also going to be increased, and there we might need to do the surgery to remove the enlarged parathyroid. Hope you like this particular presentation. We are going to take it forward in the AVD and the F2F with other findings of Paget disease, like candle flame sign, squaring of the vertebra, picture vertebra, mosaic appearance, banana appearance, These things we are going to talk about in details in AVD and F2F. This is actually a integrated medicine question which is not only important in Indian PG of central institutes but also in MRCP part 2 examination, part 1 and part 2 examination. They give questions with this sort of values. You have to remember the values there, and they put those questions. The actually difference is not the concept, the way the questions have been laid in the MRCP examination and in the Indian PG examination. If hope you like this particular presentation, write to us in the Facebook, Twitter and YouTube. We are eager to know your feedback. We are already getting feedback all over India and abroad. Thank you for supporting us. Thank you for being with us. We are going to upload most question in the JQA mode here on with little bit of extra edges like this particular questions and question, and in future we might upload few AVD like this sort of important question point. We already have talked about how to delineate the difference between primary hyperparathyroidism, secondary hyperparathyroidism and tertiary hyperparathyroidism with the osteoporosis and Paget disease and their findings. We already have talked about that. Hope you like this particular presentation. Give your feedback in the Facebook pages, message boxes, where queries are going to be answered within 72 hours. Thank you for being with us. Thank you for supporting us. We are actually appreciate your support, and we are going to upload the videos maybe with increasing intervals, but we are going to be with you also. Thank you for being with us. Thank you.